Hi, this is Lindsay, and we're back at Bone and Joint Institute today, continuing our Facebook Live series with our physicians. So today we have Dr. Chris Stark with us, and we're going to be talking about outdoor activities. Fall is finally here. Today's the first day of fall, so we're getting into weather where we can enjoy the outdoors a little bit more, make it a little bit more comfortable. So we're going to talk about what injuries can kind of come along with that. But first, before we get into that, Dr. Stark, give a little intro on yourself.
Well, I'm an orthopedic surgeon here at Bone and Joint. We've been part of the group for 20 plus years. I have a lot of outdoor activities as well, so I enjoy mountain biking, running, adventure races. So I've seen a lot of the accidents, unfortunately, and other injuries.
Okay, and what would you say would be your specialty here at Bone and Joint?
I'm a general orthopedist, and that's my training, but my background is primarily sports. That was the biggest part of it. But I still do see a little bit of all the aspects and a lot of the trauma too. Okay,
well perfect. And this kind of goes hand in hand because you did some hiking in some national parks this summer, right?
Yeah, I got to do got my whole family out for backpacking Yosemite. It's just wonderful as a kid. I recommend everybody do that. But also venture races this year. Got to do 3 of those, 24 to 72-hour races out in the woods. So biking, paddling, and running.
Okay.
Some fun ones this year.
So what types, as people are getting out and about, and you don't have to be the adventure race type even to do that, but even just going for a hike with your family or being outside, what types of injuries do you see most common in your practice?
You know, two categories. There are acute injuries, unfortunately, the bike rack or a twisted ankle. So a sprained ankle. The biking, it's more upper extremity. You see a lot of elbow, wrist, or clavicle type injury.
Okay.
Hopefully those are minor. And then the other side of it is overuse, and that's probably the bigger part of what we see. A lot of that caught early is much easier to treat. Nip it in the bud is kind of the key there.
So for those kind of the injuries like the tendonitis and those injuries that you want to catch early, so someone comes into your clinic, what types of treatment can you offer for, say, a tendonitis?
Yeah, so tendonitis is common in our endurance sports. Everything from the Achilles, plantar fasciitis, knee, very common. And then I think one of the biggest things is the hips right now, really been challenging. And our initial goal, there's some role of rest, but I think we overdo that actually. So rest should be pretty short.
Okay.
And so I think of 3 things. I tell decrease inflammation, so that's rest and ice and medicines. Stretching, that's a bigger part. And then probably the biggest part is actually strengthening that area. And so I approach every problem like that. So we talk a lot about active recovery. So if you're running a marathon or maybe just running a 5K and you're not used to it, and you pick up some tendonitis on the outside of the knee, very common, like a runner's knee. The key is not just rest, because as soon as you run, it comes back. It's really stretching and strengthening and finding a way to strengthen that outside of running. You usually have to give it a little break from the running.
And so treatment-wise off of that, I mean, we have a great physical therapy department. How do they play a role in an injury like that?
You know, it's a team approach for sure. And I kind of maybe the quarterback. It's a lot of the therapists are very, very good, and a lot of times you can go to therapy first if it's a minor problem. If it's more serious, it's causing limping, it's slowing you down, or it's lasting longer, then I often go to the physician first, then the therapist. But it's okay to go to the therapist first. But they'll work in conjunction with what we instruct, and it's working with therapists, sometimes a trainer, and then a lot of work at home too. So the home program, and if the patient is able to do the work at home, it accelerates the healing.
Okay, well perfect. And so we've talked kind of about the tendonitis and overuse. Talk about a traumatic injury. You mentioned either a fracture or a sprained ankle. Talk about a fracture, we'll say, with biking that you would see most often.
Well, unfortunately too many, but biking's still safe. You just gotta pick your routes. And, but the clavicle would be the most common, most common broken bone in the body. And a lot of them are non-surgical as long as it's pretty well aligned. The clavicle is a membranous bone, heals very quickly within.
And the collarbone up here, kind of right up here. Yep.
Yeah, clavicle. I'll use that term. Clavicle. Thank you. But if they're displaced, means they're out of position more than about a centimeter, or overriding, or if there's a lot of what we call comminution, which is a lot of pieces. It's better to fix them. And that's surgical.
That's surgical. And then what would that recovery look like?
The fixing it's almost quicker. You can actually start using the arm quite quickly, but avoiding contact and heavy lifting for 6 to 8 weeks, depending on the healing. But it's an outpatient procedure.
Okay. And would you need to go to physical therapy after something like that?
Yeah, almost always.
Okay.
Getting that shoulder, and it's not the clavicle, it's the shoulder gets tight, and the shoulder will tend to stay.
So kind of working on that motion and whatnot. Okay.
Exactly.
So as people are outside, we obviously, we'll treat patients, but we want to be able to teach them something to prevent. So you mentioned some flexibility. What are some kind of tips and pointers so that someone doesn't have to come in with an overuse injury?
The biggest thing, especially for the newer runners, but actually all runners or any endurance sport, I really believe, more I've been doing this over a lot of years, that mixing cross-training is the key. And if you just run, most of us will get hurt if we just run. There's some percentage who won't, but most of us. And so doing some weights and stretching, even if you're training for a marathon and you're trying to get those miles in, you don't have much time, it's more valuable to run less and spend some time on the bike or with weights, as well as stretching. Stretching before is okay, but stretching after is probably better. And then if you start to get sore, start having problems, don't worry about your schedule or your plan. Back off that plan, get healthy, and then finish your event that way. So better to come into a race healthy, non-injured, and be able to finish than going in injured and trying to struggle through it.
Okay. And would you recommend something like a family? Like I would go out hiking with my family. What things could I do before we go on like a mile or two hike? Just something that you can do with the kids.
Yeah. A little bit of practice if you're going to be going longer, build up. Trekking poles, maybe not with the kids, but for the rest of us, trekking poles are really nice if you're hilly and if you're a newer walker, or if you're going long, they make a huge difference. And if you have some knee symptoms or hip symptoms, it decreases 20% of the pressure on your knees and hips. Makes a big difference. With the kids, get out and do some shorter walks first, get the feeling, and once they get into it, they'll love it and being kind of consistent. So taking my whole family backpacking, I had probably too big a backpack and went too long, so it's a lot more fun if they're kind of warmed up.
And does shoe wear make a big difference when you're out and about?
Yeah, thanks for asking. Yeah, decent shoes. If you have the tennis shoes and it's muddy, it's not great. You're gonna have that sprained ankle, rolled ankle, and tendonitis. So supportive shoe, a good hiking shoe.
Okay, perfect. Well, Dr. Stark, thank you for kind of those tips and pointers. And one question that we always ask in this series is, we have such a beautiful facility here, beautiful space, excellent physicians. So describe kind of that comprehensive care that we have here in this building, and how does that help the patient experience?
Well, we've been trying to build that for a lot of years and growing that, and I think what's unique is we do work so closely with our therapists and also the trainers that are often involved in the schools, and our staff, technicians, the MAs, that they work on education. And I'll spend more time educating someone about a tendonitis than I will other people, I think. And my therapist will spend more one-on-one time because I want the patient to buy in. And if they believe it, even if they've had a problem for 6 months, they'll get better.
They'll get better.
Yeah,
absolutely.
Yeah. It's a lot of work for most of these things. They don't get better right away. It takes time.
Okay. Well, Dr. Stark, thank you so very much. Again, this was the next in our Facebook Live series. So for any questions with Dr. Stark or to schedule an appointment, you can give us a call at 615-791-2630 or check out our website at boneandjointtn.org. Dr. Stark, thank you again, and we'll see you next month. Thank you.
Thanks, Lindsay.